formal and informal, and that's why already after this we are going to have the general concepts of survival analysis. So today there will be only one breakout room where we will learn the life table. The skill part is the life table, how to make a life table and how to analyze that, and how to make a table and interpret, and then the basic concepts of survival. So in the beginning, for I guess maybe 1.5 hours or so, we'll have the general concept, and then we'll go to the breakout room. So with this, I am starting sharing my screen. So I will go slow, but in the meantime, if you are not understanding any concept, then you may write in the chat box, or you may unmute yourself and ask also. There is no problem. You can do that. That's why we have kept these sessions like we are not covering everything in these 3 days. The basic and the most commonly done concepts we are covering. So the objective is to understand the basic concepts of this time to event outcome. So till now, we have done, like many of you have attended the logistic regression and the other Jamovi, like basic Jamovi analysis also. But there the data, it was the outcome we were measuring at one point of time at the end time when that outcome happened. Here there is another concept of time to event variable or time to event data. So that we will understand what is this time to event data and why it is analyzed in a different way. Then the second is you should be able to construct a life table and survival plot using the actuarial approach, that is the life table approach. Then you will come to know how to construct life table and survival plot using a Kaplan-Meier approach, and how this Kaplan-Meier approach is different from the life table approach. Then we will learn how to compare 2 or more survival curve. If there is a categorical variable, how can we compare 2 or more survival curve? And then how to compute and interpret a hazard ratio, because you will also learn how to perform a Cox regression model, and then how to interpret that Cox proportional hazard regression analysis. So maybe there may be few concepts which you might find it advanced, because survival is an analysis where we expect that you should be familiar with some common terms like incidence, what is incidence density, what is incidence rate, what is percent time. So those things you should know, but still I will try to tell them in the session for a person who has not read, or maybe just to refresh the concept. So this, in the previous session also we started with this bottle where there are many butterflies, colorful butterflies. And if you want to know what is the average time a butterfly can survive if it is kept in a closed bottle. So there is a bottle and you have kept these, I think 9 or 10 butterfly in this bottle, and you plan to observe the bottle for 30 days. So what will be the answer? Can you know from this that what is the average time a butterfly will survive if it is kept in a bottle? So Sashi is writing, Sauntan is also writing yes. So we can calculate it. So Rizwana is also writing yes. Jennifer, Saurabh, Sinduri, Pragya, so all yes. So you can calculate it. So in this case, will you please write what is the event here? Because you need to understand what is the event here. That means what is the outcome of interest. So it is the death. So very right, the outcome of interest is the death here. And then any other thing, like if the butterfly dies or die or do not dies, but any other event or outcome which is important here. So Jennifer is writing survival time. Yes, because in this case, we will refresh this concept many times, but there are 2 important concepts here. Ultimately, in this bottle, all the butterfly has to die because it is in a closed thing. But that timing of death may be different for each of these butterfly. So we are measuring two outcome here, or there are two outcome variable. One outcome variable is the death of the butterfly, and the second outcome variable is the time of that death that may be variable from one butterfly to the other butterfly. So there can be two types of variable. So first is there can be a start time, and then there is an event. So this outcome variable is basically, there are two outcome variable like we discussed. The first outcome variable is the event, occurrence of the event, and the second outcome variable is the time until that event occurs. So survival analysis is done for this time to event data. This time can be in years, in months, in weeks, or in days. So you have to mention you are taking this time in which unit, because this will be different. Whatever you do the calculation, it will differ if you are calculating it yearly, monthly, weekly, or in a day-wise thing. And this event can be the death of the person or the death of the, in this case, the butterfly. This event can be the occurrence of any disease. This event can be any relapse, like we will see in our data. We are studying the recurrence of the second attack of the myocardial infarction, or we can again study the recovery. So this event can be death, disease, relapse, or recovery, and the time to this event can be measured depending on the days or the years of follow-up in the years, months, week, or days. So there are two possibilities. There can be one event, like in this case, you are taking it like butterfly, death of the butterfly. So there is only one event here. In many situations, there can be more than one event, or there can be recurrent event. Like if you are taking the event as a death, in case of a patient, so death due to, suppose, myocardial infarction, the patient may die because of some other disease also. There also there is a death. So this is known as the competing risk. So right now, I am talking about this competing risk. So there is a term which is known as the competing risk. And what do you understand by this competing risk? That whatever outcome you have fixed, there can be some other reason for that outcome. And that is known as the competing risk. Like I have said, if you are measuring the death after the attack of MI, when the person is hospitalized, and if the death occur in that ICU patient because of the pneumonia or because of the septicemia, then that becomes a competing risk. In that case, there is more than one event. Similarly, there can be a case where there is a recurring event. Like you have studied this, maybe MI, the second attack. There can be a case that there can be 2, 3, 4 attack of MI within your follow period. So if there is a recurring event, then also you can do the survival analysis. But in this session, we are restricting ourselves to one event. So in all these 3 days, we are not going to cover this recurring event or the competing risk. We will only focus our discussion on one event. So the time to that event, that is known as the survival time. And the event is always a failure. Failure in the sense, usually this survival time, the origin, it has come up from the cancer survival patient, where the event was death. So that death is a failure. So in that case, this event is a failure. So survival will be those of the number of people or the probability of the people surviving after this time, after this failure, who did not meet this failure. They are the people who survived this event. So survival analysis is the people who survived or who did not meet this failure. So event is failure, which we will read day after tomorrow, that we call it as a hazard. So whatever event, like we have defined event in 4 cases, there can be a death, there can be a relapse, there can be a recurrence. So in all these death, relapse or recurrence, that is a failure. The second thing is, now you please type in the chat box what is the failure in the given research question. So my question is, you want to estimate the median survival time for exclusive breastfeeding in a population X. So if your research question is this, you want to estimate the median survival time for exclusive breastfeeding, who will be your study participant? First question. So you type in the chat box all these three in single response, or the response, whatever you think that you know. So who will be the study participants in this research question? What is the event or failure in this question? And what is the survival time in this question? Okay. So Rizwana is writing. So first is the study participant. One person is written the lactating mother. One person is written the infant. Okay, so study participant will be it will be the infant, right? Because you are measuring the breast feeding in infant. You can take the lactating mother also, but obviously you are going to ask this from the lactating mother, not the infant. So it can be a pair of two people, like infant mother pair. So study participant will be true, in true sense, it will be the 0 to 6 month infant. And then event of failure. So event is non-exclusive breastfeeding. So event is non-exclusive, and stopping of EBF is failure. So if your research question is, you want to know the median survival time for exclusive breastfeeding, that means the event here is the exclusive breastfeeding. Otherwise, I would have written the median survival time for starting the alternative feeding. Okay. But in this case, if I am writing the exclusive breastfeeding, that means the event is the exclusive breastfeeding. Now, don't go by this term failure, because classically we say it as a failure, but this outcome or event, it can be a positive or it can be a negative. So that's why you will come to know this hazard. In this case, the people who are doing the exclusive breastfeeding, that is the event. So exclusive breastfeeding is the event, and survival time would be like infant who could not who could not do the exclusive breastfeeding. That will be the survival. So you have to go by the research question. So Dr. Rajesh is writing survival time is the initiation to stopping exclusive breastfeeding. So survival time is the time after which the infant, they kept on doing the exclusive, because you want to do the estimation of median survival time for exclusive breastfeeding. So till the time a person did the exclusive, like if I say that a female, she did exclusive breastfeeding up till 6 months or 5 months. So my time to event will be this survival time will be 5 months, because after 5 months, she has started the baby on some other feeding formula. So that will be the answer. Now, if the question is, if you want to estimate the median survival time for second attack of stroke, now in this case, who will be the study participant? Yes, all of you. And what is the event in this case? And what is the time, survival time in this question? So patient who had one stroke. Very true. Because I want to see the second attack of stroke. That means inclusion criteria will be all patients who have got one stroke. Very right. Now, what is the event in this question? So yes, event is the second stroke. Very right. And what is the survival time in this question? So the time will be after which recurrence, those of who have had the time will be the between first and second attack. So survival, how will you define the survival in this case? So survival is those of the individual who have survived, who did not have this second attack of stroke. That will be the survival. Who failed this event. That means failure of this event will be the survival. So this survival will be those individual who had first stroke, they did not have the second stroke. That will be your survival time. Now, the third question, you want to estimate the median survival time for blood pressure control for drug A and drug B. In this case, who will be the study participant? What is the event or the failure in this question? Hypertensives, yes. Event or failure will be the, what will be the event? So don't go by this word failure. Again, this can be if it is a positive thing, then again, we by definition, we call it as a failure. So this event is like those of control. Yes, control in hypertension will be the event. And those of the people who did not have this control, they survived. So although if the outcome is positive, while you are saying this, you will feel that, why I am saying it like that. But that's the way it has been coined, that term. That's why you need to be very cautious. So with all these, like in this case, the first thing, you can see what is the event here in this picture. Yes, all of you, please write in the chat box. The event is birth. Okay, so that's a positive. So those of the female who could not give the birth, they will be the survived. The second one, this one, if let me focus. I'm talking about this picture now. So it is the recovery. Yes, again, this is a positive outcome. If there is a fall and then the person is going, again, it is a recovery. So it is a positive outcome. So failure will be recovery here, although that is not a failure. But that's why maybe as a terminology, because the table or the data which you will have, that will be like that. And so the people who survived this event, that means the people who could not be discharged, those will be the survivor. Okay. So it's the opposite way. So by these examples, what have we noticed? There are some more examples, like first MI episode. After first MI, the second MI episode. Then again, assessment of an ointment for contact skin allergy may consider time from treatment until the rash has cleared up. So this is again a good outcome, positive outcome. You are measuring the time until the rash gets cleared. So that will be the event. And those of the people who did not have this event, they will be the survivor. Again, the study of coronary artery bypass surgery may analyze the time for surgery until death, and then they analyze the time for a fracture to heal. That is the, again, a positive outcome. So in case of a positive outcome also, those of the individual who could not have this outcome, we will call the survival probability in those individuals. So by this many examples, you have to be very careful that whenever you are interpreting the survival result and the graph, you should be very cautious in your mind whether that event is negative or positive. Since survival, I said in the beginning, this term was coined after this cancer survival, because initially we used to have this 5-year survival rate. But there is a problem in the 5-year survival, because it is not always possible to have follow-up till 5 years. If you want to plan a study for 1 year, for 1 month, for 9 months, in that case, that 5-year survival is not applicable. That's why with these concepts of like life table and the Kaplan-Meier concept, this has come up. So you have to be cautious whenever you are interpreting a survival analysis, whether that event is a negative or event is a positive. Similar concept to the hazard. So hazard is opposite of survival, or the event or the failure which we discussed, that is the hazard. And those of the people who could not meet that hazard, they survived. So like exclusive breastfeeding, that is a hazard, not as such, but for analysis. So am I making myself clear with all these examples, or any ambiguity? So Rizwana, Shashi, you are writing yes. So yes, because by survival, the first thing, even in our PG presentation, we have noticed many times that the students, they think that for survival analysis, the event should always be negative. But it is not necessary. That we have seen in so many examples. And we will share few articles with you today. You can go through that, and then you will come to know regarding these positive and negative outcome also. So in this case, in survival analysis, we conduct a study where we measure the time to an event and we measure that data, we measure that time. So you can also frame one, can you anticipate any problem which you may encounter during this analysis? Any problem which you can think of where you have got this time to event data? So incomplete data, event may not occur during the study period, loss to follow-up, yes, dropout, withdrawal, yes. So you answered almost everything. People may die, true, Swarnika is writing, Smarnika, transfer, withdrawal, yes. So just to give this hypothetical example, this is the same butterfly which you saw in the beginning, the bottle with butterflies. So this example, just see it again. And in this case, when the bottle is closed and you observe that the event, which was the death of the butterfly, and the total study period, we have fixed it as 1 month. So if you see the first butterfly, which is the pink one, so this butterfly, the start date is 24/4/2022. So I have all these, I've started my study today, and maybe I'm just anticipating that this first will, death will happen on 14th October. So the time to event is death, and the time is 20 days. Similarly, with this blue one, again, the start day, because I am starting all the observation on the same day, which is not, it is a hypothetical example. Generally, it never happens. You recruit individual at different point of time. And in that case, it is not possible for you to have all the individual, the start day as a same day. So in the second one, that is the blue one, you can see that the event met on 9th October. Our event is again death. So if you see this event, you can see in all these cases, the event was death. So I'll again show this. So you can see here that the event is death. And this death is like, so you were telling me the problems during the survival analysis, that there can be some loss to follow up, there can be some transfer, there can be some, data not available. But in this case, since this is a closed system, so all the event, you have the record of all the event. And there is one unique feature in this case, that everyone died after the follow-up, at the end of the follow-up period, which was the 30 days. And in this case, again, which is not a very common feature usually, that the start day is the same in all the cases, practically, which will not happen if you are doing actually a survival study. And this time to event, you can see, this is a variable time to event. In first case, it is 20 days, 15 days, 18, 9, 16, 15, 9, and 17. So this is one example where everyone, all the butterfly, they died, start day was same, and there was a variable time to event. Now coming to another example. This is the same hypothetical example where the start day was same for everyone. In this case, what can you see? How it is different from the first example. So in this case, you can see that now the bottle is open. You can see that closed, this is not a closed system anymore, and the bottle is open. So if the bottle is open, you can see there can be few flies which have flied from the bottle. So this fly number 3, that is the blue, green, and yellow. These 3 flies, they have flied out of the bottle, and we don't know when they, the outcome we don't know, but we have got the follow-up period till 10 days. So this fly flied on 10th day, this flight on 6th day, and this flight on 14th day. Just a hypothetical situation. And then there are two flies like this, flight number 2 and 8, who did not make this outcome. So they did not die. So this case, this flight and not died, we call this as a censored data. So any individual not meeting the outcome of event or the failure which we have defined, they are known as the censored cases. And Smarnika is right. Dr. Shibaji is here. Why didn't we follow up of not died? Not till 14th. Not died means maybe, obviously, this must have flight or something have happened. Yes, you are right. This was a hypothetical, this thing, that's why we have written. But ultimately, you see that they also flied. Okay. And then we can come to this. So this sensor data or the censorship, this is known as the censoring, or we'll understand the Anshuman is writing study ended, but we followed up. No, in this case, we followed up maybe 20 days also. So we'll see. Ideally, if the study ended, it should have been the last follow-up time. So this causes analytical problem. And because in censoring, we do not know the exact survival time, because for the censored data, we don't have the outcome, but we want to include that period of the till the time they were there with us. So in health research, the censoring, it may happen due to, there are many reasons which you people have also told, that there can be the study, it ends and there is no event, like Anshuman was telling, and then there can be loss to follow up, or the person withdraws, there is no event. That we don't know about the event because the person said that he doesn't want to be in the study. So now you will see the 4 situations for in the next 4 slides, and you have to give your opinion. What do you think about this? So in situation 1, you can see that you followed 20 males and 20 females for 12 months after their first myocardial infarction and looked for the second attack. So in the time, you see that 8 men out of 20, they had this event, and 8 women out of 20, they had this event. So yes, what will be the risk? So risk is 40% in both the cases. Okay. So can you say that the risk of second myocardial infarction is same in male and female? Okay, done. Now see the same risk in both the group. Okay, done. Good. Now see this, you followed 20 males and 20 females for 6 months after total knee replacement to look for the full functionality. So here the event is the functionality. So this event, we call it as a failure. So those of the individual who do not meet this event, they survived. So again, like we have reiterated that you have to be careful. So in this case, again, 9 out of 20 men, they recovered or they had this full functionality, and 9 out of 20 women, they had this full functionality at the end of 1 year period, 6 months. Okay. So can I say that the risk of getting full functionality after total knee replacement is same in both men and women? So yes, Saurabh, Shivaji, they are writing that it is same. Again, you followed this. Now see this. In this case, you can see just arbitrarily think that these 3, there is a 1 in between, there is a last 2, and in this case also female, male and female. So the number is different. So in this case, the final risk is same. If you see the final risk, if you count the number of individual, it is 5 and 3, 8 in case of MI. Again, in this case, you can see it is the 8 women. So 8 out of 20. So final risk is same. But what is the additional? So men got their second MI earlier. So if you see this time period, in this time period, maybe if it is 12 months, and you can divide this hypothetical as 4, 4, and 4. So in first 4 months, you will see that 5 men had the second MI. Whereas in case of a woman, it was the only one woman who got the second MI within after 4 months of the first MI. So more men suffer in the beginning and more women suffer in the end. Yes. So ultimately, you can say, yes, Dr. Saurabh is right that males are more likely to have recurrent attack earlier compared to females. So now, can you understand or can you appreciate why this survival or the time to event data, what additional information it is giving us? Because a person can say like, if the final risk is same, why do we need to do a survival analysis? So you will get this answer from this time to event data, that then you need to be like, you can, this research will have policy implications. If you can say that the men, they are more vulnerable in the first 4 months and that female, they are more vulnerable in the last 4 months. This is just a hypothetical. This is not the truth. As such, this does, I don't know that something of this exists, but this is just a hypothetical situation. So these information, this is important, because one might say that even in survival cancer study, everyone has to die ultimately. But for management, for extra precaution, for taking care of the people, this time period or this information is very important, because then we will be taking care, or the more prevention or monitoring will be, yes, Dr. Saurabh is writing more health insurance premium. Very true. Because actually this life table analysis or this survival analysis, this is very much used in the insurance sector. So they fixed premium based on your episodes of the event or overall. And for person to person, they have a data and they actually do it. So yes, it is right that they can fix the more insurance premium to the men in the initial year maybe, and then as compared to the later with the first MI. And then again, this is the same case where you can see that more of the males, they initially, females, they recovered early as compared to the male they recovered you can count, it is 5 to 7. So 7 male recovered during the later 4 months, whereas towards the end of the study, and females, they recovered early. So again, final risk is same in both these cases, but again, this information, the female, they do ambulation is easy, or ambulation is early in female as compared to male. This information is important for policy making. So will you still say that male and female have similar experience in both situations as discussed earlier? So our answer will be no. So the speed of occurrence of an event, that is also important. And how will we calculate that speed? Because then you have to take the time also in consideration. Because ultimately, like if you are going to measure it at the end of 1 year, everyone will be ambulate. Like most of the people, they will recover at the end of the 1 year in case of a total knee replacement. But how early, that's the question here. So in such cases, when you want to know with what speed the person will recover, in that case, this time to event analysis is important. So you have done your logistic regression, you have done the linear regression. There we only, outcome variable is only that event occurred or not occurred, where you used to calculate the probability. And if the probability is used to be more than 0.5 or equal to 0.5, you used to say that the event occurred, that is the predicted one. And then you used to see that whether that event happened or not happened. But in case of the survival analysis, whether that event happened or not happened, along with that, there is one more outcome variable, which is the time at which the event is happening, or time where there is a loss to follow up. So that is the additional information which is required if you want to perform the survival analysis. And generally survival analysis, classically, if you see that it is done usually on the databases, which are, you should have a good database to have a good survival analysis. So now think of some diseases and health related event you may write, which whether you can perform this survival analysis. So yes, we have given many examples. So any example which you can write from your end: cancer, death, right? Any other event? Cancer and death is COVID death, right? Alzheimer. You can think from the perspective of immunization also. COVID vaccination. Like you can perform survival analysis until you have given the vaccination, and then the appearance of the protective level of antibodies. That can also be a survival analysis. Diabetes, disability, yes, discharge from hospital, side effect of chemotherapy, but for that you need to, again, definition should be very strict, like which side effect you are saying. Old age, fall event, yes, that is also true. Fracture healing, true. Yes, so this is an important thing. And again, OCP intake and pregnancy, positive or negative, yes, can be done. Good study. Again, Dr. Rajesh is writing antibiotic and effervescence, right? Drug adherence, true. So if you want to age and menarche, yes, age of menarche, menopause. Okay, menopause, you can have this. So you can see that generally you can have a survival analysis for a month. It depends on the event which you have. Like if you are doing any survival analysis in hospital, like in ICU, there are many hospital ICU where you can have this survival analysis, like development of hospital-acquired infection in the patients who are admitted to ICU, at which day UTI, or maybe the death, or maybe the discharge, any event. That will be a short study. And if you have data like already data in a retrospective manner, and you can catch hold of that data, you can perform survival analysis on that data also. Dr. Rajesh is writing nutritional supplement and weight gain. Yes, it can be a good study, like survival study in case of a randomized control trial, where in one arm you are giving the nutritional supplement and the other arm maybe some other intervention or health education. So catheter associated infection, yes, in hospital acquired infection, this survival analysis in a very short duration of time you can do it. Those of you who are like associated, or you can plan a study with one of your colleague who is there in the ICU, or maybe in the workout weight loss. Yes, important for all the people who are working. And there again, it can be a recurrent event, because once that weight loss is there, then again, so it will come as a recurring event, which we studied. And there will be competing risks also, like weight loss due to illness, weight loss due to some other this thing. So, but this is again, it can be a research question. And if you see in physical, this sports medicine, you will find a few articles related to this also, sports person. So in this case, what we have seen in all the cases, there is a start time. And so you have this start time, and then you have this end time. So the end time can be in the form of, again, we have discussed it, recovery. It can be a form of death. It can be a form of any event which you have narrated or which you have kept as a research question. And the second will be your sensor data. That time should also be when that data got censored. So that will also be a end time. And we have seen that this time we can measure. So it is important for you to, in your proposal, to mention that how you are going to measure that time. You are going to measure that in seconds, minutes, hours, days, months, or years, because that will help in the understanding. And the hazard rate, which we will do later, that depends on the what unit you are taking as a measurement of time. Anshuman is writing rheumatism control to relapse of symptoms. Yes, that can also be there. So in any research, if you are recording the duration of occurrence of an event or outcome, you can apply this survival analysis. So usually it is, do you think that in the case of butterfly, you started, all the start day was on the 24th of September, 24th of the September. So is it possible in our research questions or in our actual research? So yes, Harshita, Saurabh, Anjana, yes. So it is usually never. There will be people. There can be a case like in case of a ICU. If you only want to perform it on the fixed number of individual, then you may treat it like a closed system. But generally, it is an open system where there are people who are coming in and there are people who are going out. So in that case, usually it is not possible, especially for even for a short duration. For long duration, it is not possible at all. It takes like years. In first year, there will be few people. Studies like RCT, which goes for 2 year, 3 year, or maybe cohort or prospective studies, which again goes for long duration of time. Usually, it is never possible to recruit even in RCT, all individual at one point of time or in a single day. So they are coming into the study at different point of time, and then they are going at the difference. Yes, so Dr. Rajesh is writing they are admitted on different dates and getting outcome on different dates. Yes, true. So like this is maybe a IPD setting, and you can see that this is related to some data entry. So now we are coming, like when you have to do the data entry, how you should be arranging the data for the survival. Because right now we have given you the exercise sheet to practice, or you will be doing it and maybe we will demonstrate it. But when you will perform conduct a research, then you should know how you are going to enter the data. So this, like in this case, you can see this patient, this is admitted on the 10th June, this patient admitted on 28th of July, this is admitted on 3rd of April. So you can see there are various dates of admission. So like if the HOD comes to you and ask like you have to brief the HOD regarding the duration of hospital stay. So will you be telling to him that this patient got admitted to June 10, or you will say that this is this much day, maybe 10th day of hospital stay or maybe 11th day of hospital stay. So we prefer to tell the next way. You say that this patient is admitted on, this is the 10th day in the hospital, 32 days in the hospital, 14th day, 10th day, and so on. So you always tell the duration. Like today when I have I'm there. So, and if the patient has been admitted previously, so this is what day of admission. So now see, this is again one hypothetical situation just to make you understand regarding the censoring and regarding the event. So these are the 5 cases, and you followed up these 5 cases of first myocardial infarction to see the recurrence. So the first case, you can see that the MI, this has happened on 10th month, and this all event, the follow-up period is for the 12 months. So we are following these individual for 12 months. So first individual, he got this event as 10 month. The second individual got this event as 2nd month, third at 4th month, and then at 8th month, and then as 6th month. So in all these cases, the event has occurred. But all these cases, they are again enrolled on 1st Feb. That's a hypothetical situation. And in all these 5 cases, the event has occurred. Similarly, this is the same case where you followed up the 5 cases of total knee replacement to see the full functionality. And all cases are enrolled on 1st of February. And then you are following these up till 12 months. And the follow-up period or the development of event, that is variable. 10 months for the first, 2 months for the second, 4 months for the third, 8 months for the fourth, and 6 months for the 5th person. So now in earlier 2 situations, you can easily calculate the mean or the median time. And you can compare the mean or the median time across any categorical variable, like in this case, across gender. So what will we do if we have to calculate the mean time? So you will add up all these time, like 10 plus 2 plus 4, 8, and 6. And you will divide it by 5 because there were 5 individuals. So the mean time or the mean time will be the 6 of happening of this event will be your 6 year. Similarly, in the real situation, the studies look like that the one individual, obviously the event happened at 10 month, the second at second month, the third at fourth month, and this blue one, the event has not happened. These blue. So second and the eighth. In this case, they are the censored individual, and this 10, 4, and 6. These are the event where these three cases event has happened. So if you have to calculate the mean, what will you do? Will you do this 10 plus 4 plus 6 divided by 3 or divided by 5, or you will take all the time? So now you have enrolled cases and they have different duration in your study. And it is not necessary that event happened in all the cases. So what will I do? So I will take only this 10, 4, and 6 divided by 3, and I'll calculate this 6.6 because I'm taking only event as an outcome. But in that case, the time, these two time, these I am missing out because I have got this information of person whom I have followed up till 8 months. I have this information also whom I have followed up till 2 months. So in this case, there will be the loss of information. So if the probability of occurrence of an event, if they vary at each time point, similarly, wherever there is no event, so whatever this we'll be doing, we will learn that these are the instantaneous probability. That means probability at that particular time point. So for such type of data, we do the survival analysis. So it is a statistical method for studying the occurrence and timing of events. This survival time refers to a variable which measures the time from a particular start time to a particular endpoint. And then the time of follow-up for such event where we have recruited the subject, it is used as a dependent variable. So this is the time to follow up or time to event. In case there is no event, then there is a loss. So that will be a time of censoring. So there are some common type of survival studies. In these type of research methods, we usually perform the survival analysis. Like in case of a randomized control trial or clinical trial, if it is a prospective cohort study, if it is a retrospective cohort study. But again, the typical survival data, they are not fully observed. In classical case, you will find that there will be many data which are censored. They are not fully observed. So now there are some features of these survival data. We have discussed that the outcome variable in this case is the time, and this time variable that does not follow a normal distribution because there is a wide range. It may have from 0 to 365 days depending on the follow-up total study duration. That's why we say that usually it is skewed in nature. And that's why the Kaplan-Meier method or the even Cox regression, they are not fully parametric, they are semi-parametric. Rather, we can say Kaplan is the non-parametric. So they are mostly skewed in nature. And even the third important feature is the censoring, which we have discussed. So there are some common terms. We have now understood the common terms like hazard, which is known as the failure. The people who could not meet this hazard, they survived. So there is a survival time versus survival data. So survival time is for each terminating event. We can record the amount of time. This time is known as the patient survival time. And then there is a survival data. The set of such survival time recorded during a study is referred as the survival data. Now there is a censored time and censored data. So survival time of loss to follow-up cases, or where the event, we could not have the event, it is referred as the censored data. And the set of such censored time recorded during the study, it is known as the censored data. So for the data requirement of survival analysis, you should define what is the event of interest. You should have the start and end point of the study, and you should have select the time scale. So this is again the same thing. You want to measure the progress of a patient until the occurrence of some well-defined event. So there can be a case where the event occurred, or there can be cases when there is a loss to follow-up. So now coming to censoring. So what is this censoring? Censoring is again a statistical term which we use to describe the process of producing incomplete observations. So now there are some reasons or some causes of these incomplete observations. So there can be case that exact survival time is not known. We will see. Then the second case could be the loss of to follow-up. And the third case will be the event. It has not occurred till the end of the study, and the study ended before. So now coming to the type of censoring. So there are basically, most commonly, there are two types of censoring. There is a right censoring and there is a left censoring. So now what is this right censoring? So whenever the exact occurrence of an event is not known because the subject is a loss to follow-up or event has not occurred till the end of the study. So in both, there are 4 cases here you can see. So in these 2 cases, the event has happened. But in this case, if you see, this is a loss to follow. And in this case, the person has followed up till the last, but at this point, the study ended. So this is known as the left censoring. So case number this one and this will be the, right censoring. So right censoring is, you do not know the exact time of occurrence because the person is a loss to follow or the study ended before that person made that event or that event happened in the person. The second type of censoring, that is known as the left censoring. So left censoring, like if the event has already occurred, but you do not know the exact time of occurrence, that is known as the left censoring. In this case, like if you are measuring the relapse, of hernia after the surgery, so you can take this surgery as a 0 time. The person has come to you at 3 months, and when you have done the examination, then you have seen that there was already appearance of hernia. So the hernia, it has developed in between these 2 time points, at the time of the reporting or the examination and after the time of the surgery. So you know that the event has occurred in between these 2 time period, but the exact time is not known. So in this case, the time to event is less than the 3 month of examination. And this is known as the left censoring. So in all our data analysis, we should try to keep this left censoring as low as possible, because for right censoring, you cannot do much. Okay, so Dr. Pragya is asking me to repeat the left censoring again. So the left censoring is, for such event when you have defined, like in this case, if I have given the example of like you have done the surgery for the inguinal hernia surgery, and if you see that there is a recurrence of inguinal hernia again after surgery, and if that recurrence is the event in your case, so maybe the person has come to you at 3 months of examination, but he's not sure when that occurrence happened exactly. So that event which you have taken, there may be ambiguity in that sense that has happened, but the person was not aware. And then when the person reports to you, in that case, yes, doctor, in that case, it has already happened. So you will say that, the occurrence is at 3 months, because you don't know that when this has happened. So you will maybe record this as 3 months, but for this, in this case, the observed time will be less than 3 months. It is definitely less than 3 months, but you do not know whether it is 2.5 months or 2 months or 1 month. So you can have some approximation, but exact time is not known. So in such cases also, you say that it is left censored. So it is not possible for those events which are very clear cut, like for death. Left censoring is not possible in death because it is a documented event and there cannot be any ambiguity. But for such cases, Like if you are taking the clearance of rash, maybe the person has noticed late and then the rash has cleared much earlier. So that's why we usually say that your event of interest, that should be very clear cut defined, so that there should be less possibility of this left sensory. So did you understand, Pragya, now what is this left sensory? Okay, thank you. So now coming to this example, you can see here, I will take some time to explain this. So this is the observation with event and with sensory. So these are the 10 patients. So first, if you see the first column, this is the ID of the patients. So there are 10 patients. This green and red, this is for the month. So this all these patients, they have been followed. The total study duration was 1 year. So you can see this 12 month. So now if you focus on this first individual, so the event, whatever was the event happened at 8th month. Okay. So we have started with this event. So this is for the first month. So on first month, there is no event. So this is the data for all 10 individual. And you can see that on first month, there is a 0 event and the total case is 10. So for cumulative percentage, what we'll do 0 by 10. So it will be the 0%. Coming to the second month. So this is the data for the second month. So if you see the second month, how many cases happened in the second month? So there is only one case on the second month. So we will write here 1 and then out of total 10. So the cumulative was 0.1%. Again, coming to this third column. So you can see in third month, how many event has happened. So there are, in this case, you can see that there are, I can see that there are, in third month, we have got this event, one event. This ID 8. Then again in fourth month, you can see that at this we are taking it as a cumulative. So there is a one event here and one event here. So there will be total of 2. Coming to the fourth month, if you see the fourth month, these are the 2 cases on the fourth month. These are the 2 cases on the fourth month. And then there were 2 cases before. So total of this will be the 4 cases. So cumulative will be 0.4. Similarly, coming to 5 months, there is a 1 case, but already there are 4. So total is 5. So it is 0.5. So this event is also cumulative. That's why in the last row, you are getting the cumulative percentage. Similarly, on the 6th month, there is a 1 event. So 5 plus 1, 6. In 7th month, there is no event. So it is 6. So this cumulative percentage is same. In the 8th month, you can see that there are 2 cases. So 6 plus 2, it is 8. And this 8 is there for 3 months because 9th, 10th, on 9th month, there is no event. So on 9th month, there is no event. 10th month, also there is no event. So the cumulative, this percentage is same. And on this 10th the month, there is a 1 case. So it is 9, 8 plus 1, 9. And here there is no. So it is none. The same percentage is there. So cumulative percentage is like total is 0.9. So this is the first example. Now coming to this second, this was with the first case. So if you draw this graph, you can see that it has rising 0.1, 0.2, 0.4, 0.5, 0.6. Again, same 0.6 because there was no event. Then 0.8, this 0.8 remained because there was no event. And again, there's up and 0.9, 0.9 because at this point, there was no event. So this is the curve or the hazard or the curve of this cumulative percentage. Now, this is another case. You can see here that on 1 month, there is a 0. On second month, there is a 2, there is 1 event. This ID number 4. Then again on third month, this ID number 8 met with the event. So there are total of 2 cases. Again on third month, there is a 1 event. So 3 event. Again on 5th month, there is 1 event. So 4. Then on 6th, there is none. On 7th, there is none. So this is 4 and 4. On 8th, you can see that 1, 2, 3, this they moved to another place. Sorry. And they lost control. So there's again 1. So if you see the cumulative, it will be like only 1 added, and this 5 will be there till end because no event occurred. You can see that there are 1, 2, 3, 4, 5 people who were lost to follow, and the rest of the people, they did not have any event. So if you plot a graph, then you see the graph will be like that. So it is like 0, 0.1, 0.2, 0.3, 0.4, then same 0.4 for 3 days, and 3 days, yes. And then again, if you see, it is 0.5 for overall till 12 months, because we are doing it for 1 year. So this will be the plotting of the cumulative percentage of that event. So you can see that if there is a data censoring, it can underestimate the cumulative percentage. In the previous case, if you see, before this, the cumulative percentage was 0.9. And in the later case, you can see the cumulative percentage is 0.5. So if there are censored data, what it will do? The censored data will try to underestimate the cumulative percentage. So in this case, you can see this is the data with, this is the graph with censoring. So if you are, if you have this censored data, then you should take into account of that data. So Dr. Saurabh is writing, let me see the chat, what he wrote. So it is not better to use incidence density in such cases. Incidence density can be done that the person time. But again, there are problems with that person time, because for that, you assume that the rate is constant throughout the period. But actually, that's not the case. For incidence density, you have to have this assumption that the rate of that hazard, it will be same during the entire period. But in case of a Kaplan-Meier, you measure that instantaneous rate. It is at a particular, in a very short span of time. So that's why maybe it's not the only way. Yes, in Cox proportional, you will see that you take this concept of this incidence density also, but there the formula, what we use, that is a different mathematical formula rather than calculating the simple number in the numerator and divided by the person time in the denominator. So it's different from that. And for that, again, I said that because you have to make assumption that rate is constant, then definitely you can have that incidence density also. And this we have given just to appreciate the need of this survival. So why we should be doing this? So now, if you rearrange the data of this survival analysis, so you can see that this is the time and this is the event. So this is, we have this this 0 and 1 is for, 0 is for the event not happened, that is the censoring, and this 1 is for the event happened, that is the whatever event you have defined. So now if you have to rearrange the data, it will be like 5 months, but the event has not happened. It is like 4 months, but the event has not happened. 3 months happened, sorry, 3 months, but event has happened. 2 months, an event has happened. So you have to rearrange the data in such form to perform a survival analysis. So survival analysis or the time to event analysis, they are suitable in studies in which the follow-up time vary among patients without events. And these methods also, they are developed to prevent the underestimation of event rate due to censoring. Because of that, that is needed. So there are basically 3 approaches for this survival analysis: the life table approach, the Kaplan-Meier approach, and the Cox proportional hazard approach. So coming to the life table approach, in the life table, you have this fixed or the predetermined interval, and the calculation is done for the entire duration. And there you don't calculate that instantaneous rate because you assume that the rate will be constant for that entire period. And in calculation of life table, the individual who are censored, because you do not know the exact time, you are calculating it for the entire period. So the exact time you are not taking. So one assumption you take that at least those individuals were there with you for half of the follow-up time. And therefore, we will see in the table to calculate the number of people at risk during each interval, we subtract half the withdrawals during the interval. That we'll see. So these are some example. I'll again, so Shibaji is writing, will the, since the life table has fixed interval, will the left censoring occur? Actually, for the left censoring, it is usually left censoring is not, it is very sensitive, this thing. And the researcher should be, he should have some criteria to diagnose or some very sensitive method of diagnosis to say that left censoring is not there. So in case of a life table, generally it is the right censoring, that is the loss to follow up, which usually happens, not the left censoring. But again, depends on the event, where what type of censoring will happen. So we will see in the example, like in our case, it is the second MI after the first MI. So obviously there is no scope of left censoring, because whenever there will be MI, you will come to know, because that person will come to the hospital for the diagnosis or for the detection. So in that case, left censoring will not happen. So before I go to this demonstration, and there's one more thing to tell in Excel how to calculate, because in the data entry, you tell like date of admission and date of like follow-up time or till the time that person was there with you in the study. So for that, I need to show you one Excel sheet, how to calculate that. So let me go to this. So we can take, I think before I start the demo, we can take a 5 minutes break, and then again so I'll just demonstrate, because in SPSS and Jamovi also, you can calculate the total time from this follow-up and start date and last follow-up date, but it is much easier in Excel. And otherwise also, we always recommend you to do the data entry in Excel sheet, because it is easy, and then you can import it in any of the this software like Jamovi, SPSS, Stata, if anyone is working on Stata. So Excel is always the recommended. Data entry in Excel is always recommended. So this is just an example. We have shown you that you have to write the start date, maybe with this first serial number with 34 age male, and the start that this person I have recruited on 9th May and 2022. And if you see in this date format, then you can see this. So yes, this is the data. So where that date format is there. Yes, so let me hide this. So in this, why this is not, this date is not enabled here. I don't know what is the problem. Let me show you some other example. Okay, I'll just close this. I'll again open this. No, the same problem is happening. So this is the start date maybe. I'll just show you the formula basically. So if you can see, if you have to calculate it, you have to do the equal to, then this is your start date. So you will take first the end date, then minus, and then start date, and then enter. And then when you click this, you will have this all days, like 9 days, 39 days. So if you enter the date, and if I'll show you on some blank format, there are some, but I don't know why this is not. The sheet one is also not. I'll show you on some plain sheet. No. Let me show on some other this thing now. Yes, so you can see here the date of this thing, discharge and date of follow-up. So you can you see the date format here on that data sheet? I don't know some problem with that data. You can see that if you on the home tab, there is a format of this date. There's a general, number, currency, accounting. So you should always select this short date. And if you click this short date and if you enter like today, if it is 24th, 26th September, so I will write 26/9/2022. So it will take this form. Similarly, you can enter. So one recommendation that all from this date, always select this short date. That will give you the start date and the, because there are various example. If you like click this number, then again, like if you see this number will be like if I write 26 something, then again 2022. Sorry, this one. So this you can see it comes as a 44830. So this number, because this Excel takes this first day as 1901. That's what I think we were showing you here regarding that count. And now it has come here also, see, with that. So can you see here that general number? Initially it was not coming. I don't know what was the problem. So this takes 1900 as one count. And then if you write it in count, this 2000 will be 36526. That is the 100 years. So you have to select, and that's why Excel, if you just minus it, it takes this because in the background it is the count which is working. So you have to click this date format, select a short date, write your start date, end date, and then in the calculation of time, last date minus start date. That will give you the total follow-up time, because in the analysis, in the as outcome variable, you have to enter this, and this will be your time to follow it or time to event, TT you can say. And when will you import this, then this will be your outcome variable. Is it clear to all of you how to calculate the time to event? Let me see the chat box, whether it is yes or no. So yes. So good. Now we'll come to the data sheet. So we'll first demonstrate with SPSS, then I'll show it with Jamovi. So we'll do it with both the software, because there are some advantages versus disadvantages of both the software in context of this calculation of life table as well as the other Kaplan-Meier also. Okay. So first we'll show it with the SPSS. So I hope you are familiar with this SPSS interface. So this is the SPSS where this data is there. You will also get a sheet to practice in the SPSS, and you can import the same sheet in the Jamovi, because Jamovi imports the SPSS format of the data also. So in the SPSS, you have got a variable view, and this is the data view. So in the variable view, you can see that this is the age in years. Then there's the gender. These are the categorical variable, race. There's a history of CVD, MI order. So I'll first show you the question. So the question is, like in a study, the researcher followed the 192 cases of first MI attack for 7 years. The second attack of MI was outcome. It was observed during this time period. So 0 was coded as censored, censored was coded as 0, and second attack was coded as 1, and 70 patients had second attack of this myocardial infarction over this 7-year period. So the question is, you have to plot a survival table across gender as a 1-year cutoff point and give its interpretation, and you have to draw a survival plot for the same cutoff point. So this is the question. So now I'll go to the SPSS data sheet, which I was explaining. So this is the gender, this is the race, history of cardiovascular disease, MI order, MI type. This is the, you can see the coding also, because you have to enter the code also in the event. So if you are not sure, you can again come back and see what is the code. So for the event, you have to see for the event. So this is the status. So I have coded censored as 0 and 1 as a second attack of this MI. And if you see the gender, I have coded 1 as male and 2 as female. So what will I do? If you have to go to analyze. So we are demonstrating the life table. And for life table, we don't have any assumption. So that's why I'm not checking assumptions. Assumptions we'll check when we'll do the Kaplan-Meier and the Cox proportional hazard. So I'll straight away go to this survival option. You can see survival, there are 3 options. There is 4 options rather. There's a life table, there's a Kaplan-Meier, there's a Cox regression, and there's a time-dependent Cox regression with a time-dependent covariate. So we are not going to discuss this time-dependent. We'll discuss all these 3. So I'll click this life table. So if I click this life table, I will again reset this. So if you see this window, there is a 2 window here. This is the time. This time is again an outcome variable which we have calculated. This is the time to event, and this is the status. So there is a one box of this time. There is a, this time is again, you can see that it is, there is a 0 through and by. So in through, you have to write the total duration. And in this case, if you see this, it is, I have measured it in days. And by this, by means how many, what interval do you want? So SPSS gives you the flexibility of interval, but again, it divides it in the fixed interval. If you write here as 365, it will divide the 7-year period. The total is approximately 3,600 days into equal 365, 365, 365. Whereas you will see in Jamovi, you can enter the predetermined period, not necessarily the same period throughout. You can enter it like 1 year, then again 2 year, maybe 4 year, then 6 year. But here you cannot do that in SPSS because it says that you have to divide it by equal number of days. So it will be like 365 days, 365, 365 for all that 7 years. And then this is the status. So this status is the event. So here you have to enter what is the event. So event in my case is the second attack of myocardial infarction or the censored data. Both are entered in the same column. And then in the factor, if you want to know this across any factor, like in this case, my question was, I have to see it across gender. So in gender, I will see, and so there are 2 factors, but it's better that you use 1 factor because again, it will have another stratification. So right now I'm not complicating it. So I'm only going by having 1 factor. So what I will do, I will enter this follow-up duration here. Then the total duration. What you can do, you can see from the descriptive also. So if you want to see the descriptive, you can go to this follow-up duration, right click this and see the descriptive statistics. So descriptive, you will see that this range is from 1 to 2357. So maximum is 2500. After that, it is not there. So what you can do, again, you come back to this. So you can, through means you can write like 2500 total. And then you may divide it by 365 if you want the equal number. And then in the status, you can enter the final status. So this is the final status, but here you have to define event. So event I have, my event of interest is which I defined it as a failure, which was the second attack of myocardial infarction. So I have given it as 1 and then continued. Again in factor, because I had to see it across gender, so I'll enter the gender here. Then coming to the options, it is the life table, which is, it will come, and then you may plot this survival curve. But again, this survival will be the, according to that predetermined, this time, which we'll see, we can edit it also. And in the gender also, if you see this, it is not still enabled. This OK is not enabled. So what mistake did I do? I have not entered the value of gender. So you can, gender, remember, we coded it 1 and 2. So minimum is 1 and 2 is maximum. So you have coded that and then continued. Once you have defined the range, you can see now this is enabled. And then now click this. So if you have clicked this, you can see there is a life table. So this is, again, you can see it has started with, this is for the male. If you see, this is for the male and this is for the female. Now I'll take some time in explaining this. So in manuscript, you need not include all these columns. I will show you how to write the result. Usually I have pasted that different forms, how we have seen this life table expression in various articles. Usually you will see this, that life table doesn't appear alone as an analysis method. The author combines both life table, Kaplan-Meier, and the Cox proportional in single publication. So whatever publication we have seen, life table was as one part of analysis of survival. It was not the only way of doing the survival analysis. And then coming to this. So now just I'll take this, you can see this is the number which are entering. So total number in male, first I'll explain for this male. It is 71. And there were 11 people who withdraw. Withdraw means there was a loss to follow up. So what we did, that there is an assumption in life table, because we have seen that this considers that you have at least followed up all the individual till half of the time. That's why you take only half of the number. So 11, half of this will be 5.5. So my total number exposed to the risk will be 70 minus 5.5, which will be 65.5. Is it clear to all of you? Please write yes or no. Because in case of a censoring, you will see the Kaplan-Meier, there we don't deduct the half, because there we know the exact time. Here we don't know, because the exact time we are not taking, neither for the time to event, nor for the, we are calculating it for the whole period. This life table, what we have read, so this life table is for the period of 0 to 1 year. That's why we take this number of people who are exposed to this, because basically it is the denominator which is important. In time to event data, in denominator, you include the censored people also. So in 65.5, you will deduct the 5.5. Why? Because you assume that half of the people, you have assumed that the censoring, it has appeared in the midway for all. That's why you take the 5.5, not the full follow-up year, not the full follow-up duration. And whatever is that, you take the 5.5, I mean half of that. So that's the assumption which we do in the life table. That we don't do in the Kaplan-Meier. There you will see that you take whatever is the whole. So then this is 65.5. This is the 2 is the event. So this proportion terminating will be your, that means terminating means that how many of them they met with that event. and then 1 minus that event will be the proportion surviving. So this 2 by 65.5, all of you please do this calculation. This proportion terminating is the terminal event divided by number of people who are exposed to risk. So all of you please do it in the calculator. I will also do here. So I will do 2 divided by 65.5. So it is 0.03. So you can see here, I'll just shift this. It is 0.03. Similarly, you can see if there are 11 people here and 2 event has happened. So how many of the person they have remained? So it is total of 13. So now you are starting with 58 individual. So out of 58 individual, now 13, there was a censoring. So again, what you will do, 58 minus 6.5, because half of 13 will be 6.5. So it will be 51.5. So, and the event is again 5 here. So the proportion terminating will be 5 by 55.5. So please calculate how much it will come. 5 divided by 55.5, that will be 0.09. So it will be, so no, they took it as 0.1. And then 1 minus that will be your proportion surviving. So this is how, again, because 13 and 5, 18 people are now out. So you are starting at 730 days with 40 people, because 58 minus 18 is 40. And then again, you can see that the 2 people, there was a censoring. So you have deducted 1. So from the 40, you deduct 1, it will be 39. And there was a no event. So it will be, for this particular period, there is no terminating event. So it will be 0. So the proportion surviving will be the 1. And now focus on this cumulative proportion of the survival. So this cumulative proportion, we do it as, it is a multiplicative in nature. So it will be like, if you have to do the cumulative for this, so you will do 0.97 into 0.90. So cumulative, again, I'll show this. If I have to calculate the cumulative proportion for this year, so what I'll do, 0.97 into 0.90. 0.97 into 0.90. So in survival, that cumulative survival, whatever we calculate, that is the multiplicative. It is not additive. So if you multiply, you can see it is 0.88 or 0.87. And then again, if you like multiply this point, again, this is 1 here. So this will be same. Again, this is 0.88. So it will be 0.88 into 0.80. So 0.88 into 0.80. So it will be like 0.72, which is here like 0.72. So similarly, you can see that this cumulation is the multiplication. You this multiply, then whatever comes, you again multiply it with 1. So basically, you multiply these two, this 0.88 and then 0.80, then 0.70 and then 1, and then 0.70 and 0.43. And similarly, you will get the cumulative proportion. Is it clear up till this point? Similar thing you will see with the females also. So Dr. Shivaji is writing, it is assumed that those lost to follow-up are present till half of the time interval. Yes, the same. So half of the total who are lost is included. And this concept is similar to, okay, yes, media population. But why half, it is not clear. But that's again the assumption that out of 11, it is we assume that only 5.5% they have full year of follow-up. and half of them, because you have followed up everyone till half. So that's why the total person here will be half. It's just the assumption. That with that assumption you have to go. That's the assumption in the life table, because you don't have the exact time of follow-up. So this is the one. Then again, you can see the median survival time. So the median survival time for male, it is 2007 days, and median survival time for female, it is 1852. So you can see that the median survival time for female in 1852, 50%. How do we define median survival time? That in that 50% of the individual, they will meet the number of in the days, 50% of the people will meet this event. This is the median survival time. We'll see more in the Kaplan-Meier about this median and mean survival time. And this is the survival function. Again, you can see here, this is not according to that fixed interval which we have given. Here you can see in the plot, it is the 500, 1000, 1500. You can change the axis. You can double click this, and then you can go to the x-axis. And here you can see this, instead of 500, you can keep it like a 365. So double click it, go to x-axis. In the major increment, you do this 365, apply this, and then close this. You will see that now it is in the form of the same 365, 730, 1095, and so on. And this is the curve for male and female. You can see that this green one is for the female. So there you can see it is survival is poorer as compared to male, because there you can say the mean survival time is also larger. It is 2202 days. So that's how you can interpret the life table. Now, how to write that life table, that we'll see again when I'll show you how to enter this in the interpretation. I'm deliberately not touching one component here, which is then you can see like this is 1 minus this thing. And then this is the cumulative proportion, which you have seen. This is the standard error on the basis of which you can calculate the 95% confidence interval. And then you can again see there is a hazard rate. So this hazard rate, if you'll see, all the values are 0. So can anyone tell me why this all hazard is 0 here? So actually hazard is not 0. If you see this, dental council. So if you see this, I'll double click this. And if you see the value of hazard rate, can you see it is not 0? In fact, it is 0.00085. Is it visible to all? So maybe in the column, you need to enter this hazard rate. In this case, it is coming very less because you have measured it in days. So if you measure it in, as you increase the measurement of unit, you change the unit, this hazard rate will change. This we'll do day after tomorrow also. So this, what does this mean? What does this meaning of 0.00085? This means that if you follow 10,000 people, there will be, so how many 0 are there? There are 1, 2, 3, 4. So if you follow 10,000 people or then the episode will be like 0.85, or maybe if you increase 1 lakh people, then there will be 8.5 episode of MI per day, because you are calculating it in days. If you change it in months or years, this 0 will be converted into some number. Okay, that we'll see again. But this is the hazard column of hazard rate, which is appearing as 0, but it is not 0. So is it clear to you? These columns, then maybe I'll go to the Jamovi and will show you there also. Yes or no? Please type in the chat box. There. Yes. Okay. Thank you. So if this is clear, I will now go to the Jamovi interface. So I hope all of you know what is Jamovi and how to perform the other basic analysis in Jamovi. Anyone in this group who doesn't know about Jamovi, then I'll explain uh, from beginning a little bit. Please type in the chat box. That will help me to understand from where I have to start. Anyone in this group you don't know? Okay. That's okay. Even if there are few people, I'll explain. So new to Jamovi, then what I'll do, I'll open it since beginning. So I'll close everything. So suppose have you installed Jamovi? All of you, have you installed Jamovi? Yes. Good. Then if you just press in this window and write Jamovi, this icon will come and click that. So this software will be opening. And because if you have this installed Jamovi, then this survival module, it is not there in the beginning, in the basic module. So the interface is like this if you have opened it, okay? So you can see there are many icons here. There is exploration, there is a t-test, there is a ANOVA. So in Jamovi, what happens in the, like in SPSS, you have seen that there is a data and variable view and there is an output view. So what we have seen here, that this is the output view and there is a data view. These two views are different. So you need to click both separately to see whether you are in the data view or in the output view. But if you see this Jamovi, here you will see in the same interface, you can see that there is a data view and there is a output view. Dr. Shamshad is showing me the time that I have to do it fast, otherwise we will be late. But still, this is important. So this you can see that this is the your data view, and this is output is your output view. So you have the advantage of Jamovi is that in the same view you can see the data as well as the output, and it is dynamic in nature. That means we will see how dynamic it is. If you like move this variable back to the window, this result will disappear. That option is not there in the SPSS. The other advantage of Jamovi is that it is freely available and all of you can do the analysis. It is a R based, all the commands which are written, those are basically the R commands which has taken from the R modules. And in that case, you can see that those of you who have not installed this JPower or survival, this will not be visible in your case. So what you need to do, there is a plus sign here. And in this Jamovi also, you can see there is an option of variable. So all variables are there like A, B, C. These are already created one by default. Then there is a data. In the analysis option, all these analysis is there. So for other basic knowledge about the Jamovi, you can see our videos which are there on the website regarding how to import data. But still, I will show you how to import data for the survival also. So first, before you import data, you need to go to this plus sign. So if you click this plus sign, it will show you these are the installed module. And now because you have to install, then you have to go to the manage installed. So if you click this manage install, these are first it will show you these are the installed one. Then there is another option which will show you the available one. So if you click this available and keep on scrolling down. So this is like scatter, this is RJ, this is JPower, come down. Then this is the structural equation modeling. This is the advanced mediation model. These are the Bayesian. So you need to distinguish by survival. So again, come down and then you can see there's this J survival. So this J survival is the survival module of ClinicoPath for the Jamovi. There's also one survival module, which is basically only the graph is there. And there are a few other options, which is with the name of Death Watch. But this is more important, this one. J Survival, survival module of Clinicopath for Jamovi. So if I am doing this till the time, you people also, those of you who are on the laptop, please install this so that when you will go to the breakout room, you will be able to do the analysis. And then these are installed in my PC. That's why it is showing you the option of installed. Can you see here? It is showing you the option of installed. But if you see the other options, like if I go up, you can see this toaster. So in your case, it will give you the option of install or something like that. If you click this, that module will be installed in your PC and it will appear here on the upper ribbon here, like it is showing up here, survival. So this will appear here. So all of you, please do this till the time we are going to the breakout room. And then I'm showing you now how to import data. So click, you can see there are four horizontal lines here. Click on this, open, and then you can see here, you have to show it a path. In this PC also, if you go to this data library, there are few data set which the Jamovi has given, but we are going to import the same data which we have, where we were performing our analysis on SPSS. So I'll go to this browse option. I click this browse, and then on day one, this SPSS. So I've told you this, that this import all the data file. If you see the type of data file, you can see it can import Jamovi, CSV, open this document, Excel, SPSS, R, Stata, SAS, JASP files, or files it can import. But I have this SPSS, so I will go to this open, browse, and then I will open this survival demo because that's the data set. And this data set, okay, so SPSS data set is open. Probably that's why it is not importing. So I have to close this too. So now again, that SPSS sheet needs to be closed, otherwise it will not be imported. So go to browse, survival, open. And now you can see that the data is open here. So if you click this variable, you can see all the variables like age, gender. If you double click this, you can see, like in SPSS, we used to define variable. So the type of variable, whether it is integer or what, and its coding, you can see here. So for more detail on the basic of Jamovi, you can see our previous videos where we have shown you some basic operations, how to do it in Jamovi, probably. Then it will be easy for you. Maybe in breakout room also, you will practice on few more. So right now I'm going to this data set, and there you can see this analysis. So in analysis, if you click this analysis, you have to open this survival. So in survival, you can see there are many options. We will use this first option. That is the survival analysis univariate. So what this R does, or this Jamovi, it gives you the output in the form of all the three: Kaplan-Meier, the life table, and the Cox proportional hazard, all the three together. Because I said that usually in every paper you will see that people have performed all the three together, especially the Kaplan-Meier and Cox proportional. Life table is not very commonly done in health. Like we were discussing, it is more in the that actuarial analysis or insurance sector. But yes, there were articles which we have found out in the health sector also. So here you can see there is an option of time elapsed. So here I will enter this follow-up duration because it is in the time. You can see this icon also. This is an icon of scale variable. Then I can go to this follow-up status. And here you will see that it asks from this drop-down menu only. So my event is the second attack of MI. So I have entered this. An explanatory variable is the gender. So I'll go to this gender and I'll enter this. And once I have entered this, you will see that the result, it has started appearing. It is now buffering. It takes some time. And here you can see it gives you the total number of individual in male and female. What is this root of mean, standard error of mean, what is the median? We'll come to all these median survival time table, and then it gives you the Cox also, but right now we are not focusing on these two. We are going down, and there is, you can see that this is your 1-3-5 year survival. So it takes 1-3-5 year. That means whatever we have done the study till 5 years, so it will tell you the 12 months, 36 months, and 60 months. So if you need to change this, because I have given you the question with 1 year interval, so you don't use these options. Come to this survival table, and in survival table you will see that this is 12, 36, and 60. Here, if you have to do that, now you can enter the days. So you can enter like 365, because you have to enter it manually now. Like SPSS, it doesn't give, if you try to make unequal interval also, it is possible here, which is not possible in the SPSS. So it will give you like 1095. Then it will be like, I have just written this time interval, it is just in the form of 65 because I have measured it in days. So 365 plus 365 plus 365, these are these numbers. And then 1825 and then 2190. So these are the cut point. And if you click this, now you can see that this is dynamic. You have changed it, and now this time this has automatically got changed. And these are the numbers, but this doesn't give you the table, any column for the event who were censored, like censored data. It only gives you the number at risk, the number of events, and then the survival probability. And this survival probability is the cumulative probability, which we have discussed in the SPSS, that you get it by multiplication. It is the multiplicative in nature. And then it's 95% confidence interval. So this is the way Jamovi gives the output of the life table. Now, how to write interpretation? So if I go back to my presentation, so I've just pasted few results of various articles. So you can see there is one article on risk of breastfeeding cessation among low-income women, infants, and children. And we will share this article with you also. And if you see this life table, how they have presented the result, they have done they have taken like 1 year interval, like 1 month interval, not year. So they have taken like 0, that is birth, 1, 2, 3, 4, 5 till 12. Then there is one column which describes the number who were breastfeeding at the beginning of the month, which is also known as the risk set. And these are the individual. Yes, Dr. Saurabh. Okay, so should I explain that commands and then I should come to this? What do you want, Dr. Saurabh? Or should I explain this and then again I'll repeat that command? Is it okay with you, Dr. Saurabh? Okay, thank you. Thank you. So this is the beginning of the individual. These all numbers you will get from the software. You don't need to worry about that. The only thing is what to include in your table. So then again, the second is number who stopped breastfeeding during the month. This is the event. The number who were censored at the end. So they have given the censored data also. And then the proportion who were breastfeeding at the beginning of month and stopped during the month. This is the hazard function, which I was discussing, the hazard rate, that column. And they have also given you the proportion who were still breastfeeding at the end of the month. This is the survival function. This is again cumulative. So by this, you can see that there were 66. If you multiply this by 100, 6.6% of the people at the end of the 12 month, they were still breastfeeding their child. So this is one way of presentation. Again, there was one article. The title of the article was the Cox proportional hazard regression analysis of gender differences in the treatment retention among clients in a faith-based residential drug treatment program in Taiwan. So they have measured this time to event in months. They have again followed up, the total study time was 1 year. They have only given the two values in the male and female, the survival and hazard. That is one way of presentation. Another, you can see there was another survival where they have presented the life table. So now they have given, instead of the time, this thing, they have given the interval. Like in your case, you can measure like 0 to 365 years, 360 days, 365 days to 730 days. So they have taken it as an interval. And they have given the withdrawal, then exposed to risk, relapse, survival rate, cumulative survival, and hazard rate. So there are people who are giving hazard rate. And then again in another, you can see they have also given. Again, you can see, you can again compare the two, the difference in the two survival probabilities also in male and female. So again, I will show you the command. So I will move these back to wherever they were. So now nothing is there. Even I will stop. I will again go to this survival, open this survival analysis, then this window will open. Here you can see again, this is same as SPSS, where you have to have a two outcome variable. One is the time elapsed and the other is the outcome or the event. So in the time elapsed, I will enter this follow-up duration because that is a scale variable. In the outcome, I will enter the follow-up status. And the status in SPSS, we used to give the coding 0 and 1. And in here, you can see I will select the second attack of MI. Explanatory variable in this case is gender. So I will enter this gender. Again, I'm not using any of these options, but yes, if you want to know whether the median survival rate is different or the survival graph is different, then you can use the option of pairwise comparison. So if there are only two groups, you can use, if there are more than two groups, you will have pairwise comparison like we used to have in ANOVA, where it used to compare between 1 and 2, 1 and 3, and 2 and 3. But here you can see there are only two categories, so it will give you the comparison. Again, you can go to the plot. You can click on survival plot, and you can in the plot again, you can have the 95% this interval. Again, you can change this to total. If there are 2500 days, you can change the plot 10 times this thing, and it has a 365 days. And it will also give you the risk table. And in this case, this survival table. In this survival table, I have entered these cutoff points. If you don't enter this, by default, it takes 1, 3, and 5 years. But in the question, if you see, we have deliberately given you the question of this, like draw a survival plot for the same cutoff point, for 1 year cutoff point. That's why I'm showing it. So I have entered like 365, 730, and 1095. And that's how you enter this. So is it clear, Dr. Saurabh, that those commands? I'm coming to the plot. Actually, I'm not deliberately telling you. So this, in this case, this if you see this pairwise comparison, this is writing that no pairwise comparison when explanatory variable has less than 3 levels. So this doesn't give you, but in SPSS it is there. And this is the survival plot. You can see this orange one. It gives you the p-value also. This survival, this gender. This is 0.02. This gives you the difference, and this gives you the risk table. This is the risk table. This you should also give. So this graph, the graph is very beautiful in Jamovi as compared to SPSS, because the risk table also you can have in the base. And also it gives you the 95% confidence interval also for this. And you can see here that the median survival, that is less for the women, because this red one is for the women and that blue is for the men. And then again, if you go up, These are the probabilities, the cumulative survival. So it gives you already the cumulative survival. You don't need to calculate it like you do in the SPSS. In SPSS, just for understanding, I told you that we multiply each probability to have a cumulative probability. Here, the software gives you the cumulative probability. Now it is important to you to interpret what do you mean by cumulative probability. So like in this case, you can say that the end of maybe 2190, the overall probability of MI, the people who survive, 35.2% of the men, they survived, and the survival cumulative probability for the female was 10%. So it was less for female as compared to the male. And this is the 95% confidence interval. So for the demonstration purpose, I have just copy pasted this. Okay, so our censored data, you can click this also, then you will have a censored. But that table, it doesn't appear. Here you can see the dash, 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 dash line which is appearing. This is the censored. Hazard rate, that doesn't, this doesn't give the hazard rate. That's why I was telling you, maybe there are many paper where, that's why I have shown you those 4 type of presentations. If you see this, again I'll show. If you see this, it's up to you whether you want to show the hazard or not. Here they have not given the hazard. They have only given the cumulative survival at 1, 3, 5 and 10 years. Maybe hazard, basically, the more interpretable is the hazard ratio, which you will learn in the Cox regression. That's why maybe not important at this juncture to show the hazard, individual hazard. Maybe, but again, if you want, you can take help of SPSS. That's why we are telling you both. Because there are some functions which are there in Jamovi, some functions which are there in the SPSS. So you should be able to take which one is good. Like we will recommend that for graph, you always take from the Jamovi, because that's a very beautiful graph which is not there in the SPSS. But table also, that it is good in Jamovi, because as such you can copy paste it with some of the modifications. And in SPSS, you need to do a lot of modifications. So like in this case, you will see there is only this probability. And then you will see here, they have mentioned the hazard rate. But again, here you will see they have only mentioned hazard and survival. And in this case, you can see again they have mentioned. So it is up to you. If you want to mention hazard rate column also, take help of SPSS and then you write it. Or you can use Jamovi and give hazard ratio, which is more interpretable, because in these articles also you will see that later they are using the Cox regression proportional hazard method. They have given the adjusted hazard, because right now it is only the hazard for each interval in life table. So life table, I said in the beginning that it is not a very popular way of doing this survival in health. Most of the time you will see it is the Kaplan-Meier and the Cox proportional hazard. Okay. So now before we go to the breakout room, I'll just explain how to write the result. So this, I have just pasted that Jamovi table for ease, and I have just deleted odd list male. There's a one column where there's male and female. And then maybe I have given some title like the relationship between the gender and survival rate for the second attack of myocardial infarction. And this is, I have written the interpretation that like that the relationship between the gender and survival rate was performed using life table approach. And based on the life table model, the survival accumulations at these time period in males were this, whereas in female, this was this. The same which is written in the table, sorry. I'm sorry. And the survival at the end of 6 years, it was less in female as compared to men. And the difference in survival function of male and females were statistically significant, because you can see the value of log rank here that is less than 0.01, which you can see in this graph also. So here you can see the value is, p-value is 0.028, and it shows that there was a significant difference in the survival, the cumulative survival probability of the male and female. So is it okay up till this time point? Then we can move to breakout room.